talking to you about the Atrium Ocean chest drainage system and how to use it for an autotransfusion in the event of an emergency. For Bridgeport Hospital protocol, the ATS will be used for any patient presenting to the emergency department with a history of blunt or penetrating chest trauma. The blood to be transfused must be less than 4 hours old and must be a volume greater than 700 milliliters. Autotransfusion is contraindicated in suspected thoracic or abdominal injuries with possible enteric contamination. Here is the equipment that is necessary for an autotransfusion and chest drainage system. Atrium chest tube drainage system, wall suction and tubing, 2 40 milliliter bottles of ACDA, blood tubing, and a Paul microemboli transfusion filter. Next, we are going to prepare the ATS. After removing the ATS from its packaging, engage the floor stand and set it on the floor. Fill the water seal chamber up with 2 centimeters of water. Fill the suction control chamber up with 20 centimeters of mercury of water. Obtain ACDA, the anticoagulant citrate dextrose solution. Instill 70 milliliters of ACDA into the collection chamber on the top of the ATS. Next, attach the thoracostomy tube from the patient to the ATS. Attach suction to the suction system on the ATS and turn the stopcock on. Just a note, never clamp the stopcock when you are transporting a patient. The system here has an automatic water seal which will prevent any air leakage. Next, we are going to set up the ATS chest tube blood bag. After removing the blood bag from its package, you're going to ensure that the ATS collection tube is closed as well as the clamp on the blood bag. Want to remove the spike from the blood bag and open up the tubing on the ATS collection port. Insert the spike into the port. Next, we are going to open up both clamps. We're going to break the seal on the ATS blood bag and we're going to let it fill up with the blood from the collection tubing. You're going to let the blood fill up to 700 milliliters in the blood bag, which is prepared to be autotransfused. After the blood bag fills up with 700 milliliters of blood, you're going to reclamp the ATS drainage tube, clamp off the tube on the blood bag. You're going to remove the spike from the drainage tube and place it into its holder on the blood bag, and replace the cap on the drainage tube. Place it back onto the holder on the top of the chest drainage system. Now your blood bag is set up and ready for autotransfusion. After filling the blood bag with 700 milliliters of blood, you will need to obtain the microemboli filter, which you will insert into the port on the bottom of the blood bag, like so. After inserting the filter, you will obtain the blood transfusion tubing. Standard tubing is fine. Take the port on the blood tubing and insert it into the microfilter. Next, you're going to prime the line. After priming the line, you can attach the blood tubing to your patient and begin your transfusion. Thanks for watching, and enjoy the rest of your shift.